Hello and welcome once again to this channel, Clinic Wahala by yours truly, Dr. Catch. Currently we are doing a series on stroke. We've talked about what stroke is, how it happens, trying to describe the brain and how it affects the body. We have also talked about the features that you see and you will know that this is a stroke. Let me run fast to the hospital to see how this person can be saved. We've mentioned them. If you happen to see this as your first video, please kindly go back to the other ones. I beg. Just go back to those ones so that you can be up to speed and follow up with this video. Thank you very much. Okay, today, having established all those facts, what can we do? How can we prevent this stroke thing so that we will not be a victim? The funny thing about stroke is that, unlike before when we assume it's only old people that have stroke, you need to be up to 60, 70 before you have stroke. It's a very big fat lie. Yes, it's a lie. Many young people have stroke. Some have had stroke as early as 20 years. Some have had in their 30s, some in their 40s and 50s. Stroke can actually happen to anybody. There are things we call risk factors. If you have been following this channel, we've had a discussion on cardiovascular risk factors. One of the early discussions when this channel was birthed. We've talked about cardiovascular risk factors. So we mentioned that these cardiovascular risk factors, when you do not take them seriously, you have cardiovascular complications. And one of the cardiovascular complications is stroke. Yes, stroke is one of the complications we mentioned then. That's what can happen to someone who does not take these cardiovascular risk factors seriously as we age. That is very true. Yes, for stroke, the risk factors are also divided into modifiable and non-modifiable risk factors. Modifiable means that you can do something about it. Yes, you can modify it. You can do, it's pure English. You can do something about it. While non-modifiable means you cannot do anything about it. That's the way it is. Just deal with it. So we'll start with the non-modifiable risk factors. Age is one of them. Everybody will grow old. Stroke is more common with the elderly. Yes, that's true. That doesn't mean younger people will not have stroke. So the more you age, the more we have changes in the body, and the blood vessels, those pipes, become a bit hardened. We tend to have some clots, we tend to have some fat deposits interacting with other things in the arteries to narrow the space of these pipes called arteries. So we call it atherosclerosis. Those things, as they narrow those arteries, they limit blood flowing through. So if something happens and that narrowing is now blocked by a small clot, wahala. A stroke can occur if it happens in the brain. So age is a risk factor. It's also been found that black race, so we black race, we are more at risk than the whites. We won't go into that. Then for my fellow men, they said male has a higher risk of having stroke than female. With him man do man, who will continue to forge ahead. Okay, so another thing is a family history. If there is a family history of stroke, there is some genetic predisposition that can follow stroke. It's not always the case, but yes, there are some things that can happen in a family that is transferred from father to mother that may have led to stroke. There are some hormonal problems, there are some metabolic problems, there are problems with things in the blood that makes someone have more clots than usual. The person will have more clots in the system than usual. There are many conditions. Example is the SLE, antiphospholipid syndrome, but you don't need to break your head about that. So those ones can happen. All right, so then we'll talk about the ones that we cannot modify. Yes, there are some we cannot. Sorry, we've done that. We're talking about. We are now going into the ones we can modify. I've been singing it like a song here. Hypertension is something that we can treat. It's something we can tackle when we take our drugs regularly. Not to take our drugs and we leave it as if it went on vacation. It doesn't go on vacation. Hypertension, diabetes, they are all serious facts. Hypertension is the commonest. Hypertension and diabetes. If I've seen strokes in my life, I'm sure over 90% was caused by hypertension followed by diabetes. So you see that you don't play with those things. When they are there, just sit and take your drugs regularly. If you take your drugs regularly, they will likely not give you any of these complications. It's important. Yes, there are hypertension can also affect the heart, lead to heart failure, which can give you stroke. It can make the heart beat anyhow. That can also cause stroke to happen. So you see, then we now go to the important area of our lifestyle, alcohol intake. You know, say people don't swear, say they must always beer, they must always maya, they must always shayu. So you need to help yourself. You know, currently it's said that the risk of cardiovascular issues you have with alcohol is dependent on the dose you take. It's no longer the one they say they measure. If you don't reach this stage, no problem. Anyone you take, you will face the risk associated with it. So alcohol must be minimized. Smoking must stop. It has its way of affecting the blood vessels and can cause stroke. Then for younger people who do cocaine, amphetamine and these drugs, they can narrow the vessels. They can cause stroke. There are causes of stroke in the young people. So it's important that you desist from such. If you're a young man and you are still doing those drugs, wahala deal. Physical inactivity for those who do not exercise. We are still going to do something on exercise, but I've mentioned it severally. Lack of exercise, obesity, all are risk factors for stroke. If you are not working out, you don't need to gym to work out. If you can take your walks, walk is part of the aerobic exercise. Do your walks, 30 minutes to 40 minutes of non-stop walk. You are good to go for at least 5 days a week. So you need to be active. You need to walk. You need to run far away from obesity. Then for those who are especially post-menopausal, they are now in menopause and taking some of these oral contraceptive, the hormonal pills, they also need to watch their BP and all, because that may increase their risk of stroke. For young people who also there are other things that can affect young people, like those who have sickle cell anemia. They are prone to, or they have an increased risk of stroke. Things like HIV and some other genetic things are all risk factors for stroke. So it's important that you look at, I've not exhausted them, there are so many, but at least I mentioned the very common ones. The essence of this is that prevention has always been better than cure. Prevention is always better than cure. Now that you know these risk factors, as people have asked me to do, I've done it, so you need to listen to them, go through them again. Anyone that you are not doing well in, you try and help yourself. Anyone that you are not doing fine in, you help yourself. Yes, some people will ask, cholesterol, they want to talk about cholesterol. Yes, that's also a problem. Yeah, if high cholesterol levels or elevated bad cholesterol and low good cholesterol can also cause stroke. Yes, so all these you need to help yourself by controlling your numbers. If you're hypertensive or diabetic, then try and exercise, get down that weight, do a little bit of dieting and exercise and bring down the weight. The things that you can avoid, biko, please, ejo, avoid them so that you do not fall into the hands of stroke. It can affect so many aspects of our lives. We don't want it to be so. Thank you. You've heard the risk factors. You can like the video, subscribe to the channel if you have not, call others to come and join you and hear. If you hear something good, you ask them to come and join. So call them so that they can subscribe. Then more importantly, send them this video so that they will learn. You see the way I'm even almost panting from talking for how many minutes. So please, they also need to hear this. Share to them. Thank you very much. Have a great day.